is a daily struggle. From the moment you wake up, the decisions you make, to what you eat for breakfast, to the way you're gonna schedule yourself for exercising, mindfulness, and everything else that you do, will have an impact on, even if you need to go into the healthcare system, right? Because you might be able to proactively do it. I'm working. I'm working not only with people in the wellness space. I'm working with Sylvester here in the Cancer Institute, and it's amazing. People like Dr. Neimer who see this, right? And he says, the future of cancer is prevention, right? The future of cancer is start doing blood work and MRIs at 20 when you're 20, right? Start measuring your baseline, because then if you see a change, you can act on it, way before it's too late. So all that is changing dramatically, the way that even clinical institutions are looking at it, because they realize that there's many other things that we could do way before that could change the perspective and the chances of someone having a healthier life.
So all three of you, thank you. All three of you have mentioned data in different ways, right? And as a patient, you have access to a lot more data. As a clinician, you have a lot of data. As a health system, you have a lot more data. As a pharma giant, all of these different players have a lot more data in some ways today than they ever have. It currently still feels like a lot of this, and especially, as a consumer, a lot of it still feels kind of like a black hole or a lot of noise, right? So how do we get this data at each of these different levels, and obviously if you want to focus on one or the others, feel free, to actually be meaningfully useful?
Well, I want to start with something. There's a lot of data, but as I think someone said, the promise is there. My sister is a nurse practitioner. She's my cardiologist. She doesn't have good tools. I mean, her biggest frustration, it's how fucked up it is that she has to click through a bunch of old school screens to try to understand what's going on with her patient, wasting a lot of time. And she sees my technology, she's like, I wish I could, have something that would, tell me exactly what to do, not waste my time, so there's a lot of tools and a lot of things, but when you look at, especially where, the big systems, what they have to work with, it's still not there, right? Hopefully it will be there very soon, but it's still not there.
Yeah, the bigger problem, I think, is it working? Yes. So the bigger problem, I think, which I think you're working on, is the connection of the different data points across owners of those data points. Because I do lab works in a place, I share my lab work with somebody else only if I manage to get a PDF and share it, and hopefully somebody sees it. That is the basic stuff, right? And then there's all the other things, my habits, my all the things that I do every day that don't fit within a framework that everybody shares. And that is, in my mind, the biggest problem today. I think somebody's working on navigating the relationship between you and the different doctors. One thing then is to work with your primary care physician. Then you have the specialists who don't talk to each other unless you're in a very complex case. So this is happening, and this is a big problem in healthcare today. So there's a lot of data points, but not a lot of systems that actually bring them together in a cohesive way.
I totally agree, and I think you're talking a lot about the democratization of data has not reached the person who is really the owner of that data and who the data is about. But I think that then there's another layer on top of that. Even if we solve that problem and every single patient had access to every single data point from their smart watch health app all the way to their specialist lab reports, then there's the interpretation of that data. And then I think you really get into an interesting space with AI and regulation, and how can you leverage, the hundreds of thousands of events every day in Claude, ChatGPT, et cetera, where people are uploading their lab report and asking for interpretation. And I think that that's also a really interesting space.
Welcome everybody to try Betterness AI, betterness.ai, because you will see a glimpse of a lot of this. We're already connected a lot of, not only basically very detailed lab analysis that you could upload, you could do it with us in all 50 states. We connected it to lifestyle as well, family history, very, very detailed family history to know everything about, your grandparents, what they die of, at what age, and all that, connected in a very, very detailed intake. But then, connected it to the real world, because as you said, I mean, one of the things I learned in my last company was we did psychedelic therapy, right? So, we had a clinical intervention, which was we prescribe you ketamine, or, which was a treatment that we did. But then when we had that window of relief, the question is, how do I support this patient? And the real support was done with non-clinical work, right? Yeah, we did meditation, yoga, we did, and that didn't fit in the EMR, right? So we had to build our own sort of graph, and we doing the same here at Betterness. I mean, the idea is, we connect all those points into everything that you do, so that way, because as I said, wellness is sort of a daily thing, right? So I have, I'm in Miami, this is where I live, I have my gym, I have my habits, but now I travel, and what do? Does the hotel I have the gym equipment for me to continue what I do? What do I eat from the menu in the restaurant? What do I eat around it? Where I could continue my yoga or my Pilates or my meditation or my, red light therapy or whatever it is, right? So, and if we could bring those points together in a way that scales and is personalized, then it becomes much easier to be able to do it. So in a way, that's at least what we're trying to solve with. And as I said, make the small business that has the trust, right? I mean, I don't know if I'm so passionate about helping small business in wellness or in fitness, because on the clinical side, everybody has a bad mood, everybody hates their job, and all that kind of stuff. Every small business that has a gym owner, that person wakes up at 4 or 5 in the morning, opens the gym, knows everything about everybody that goes to the gym, is trying to give advice on everything that they can give advice on, and it's still for short, because they don't have the training or the tools. So we're like, okay, what about if I wrap around things around you? What about if people could do labs? And then, I could interpret those labs, and I could tell you, okay, the strength training, could fit this way into that, but in addition, you have either prescription or non-prescribed interventions that we could give you, and then you could really help that person in the journey without you having to get involved in things that you're not set up to do. If we do that at scale, and we do that I think the whole industry would evolve. And obviously, you bring the clinical side when you need to bring it. But even like, for example, I work with a lot of longevity clinics as well, and concierge doctors that I think what I see, at least again in my perspective, is they really care about going and digging deep, and like what you said, like people go there and like, don't bother me with like all these extra labs, because whatever. Longevity doctors, at least I guess they get paid the money for all that, but they really go deep, and they're like, they want to go into metabolic, cardiovascular, VO2 max, this, DEXA scans, how's that fitting? They actually love that a patient comes in educated, because when they come in, the conversation goes straight to how I could, help you with the right decisions that you need to make. Again, unfortunately today, that's only, available to maybe people that could pay for that. But I think eventually it would open up more, and hopefully it makes the life of the people that today are not having a good time being in the clinical space, enjoy more and feel that they could help more people.
Thank you. So AI and healthcare have been in the news extra, right? The last, week, I feel like, with Claude and the ChatGPT announcements. So what is an AI and healthcare kind of intersection use case that you think is maybe under-discussed, but could be really remarkable?
So I've been operating a lot with not only the users, but also the users and the insurance company that they have, and the employer that pays for that insurance. I think one of the most challenging parts of it being in the US is navigating the healthcare system around you. And I think that there is a lot of work, rightfully so, about the user and how the provider uses data, like to do a better diagnosis or treatment or care pathways, and so personalization of care. But the reality in my mind is that navigation of the healthcare system in the US is a nightmare for the majority of people, and many people don't have access to care simply because they don't even know that they don't know how to get access and how to get the help that they need. So I think that's something that is really powerful would be the area of navigating your ecosystem. And by the way, not only of your insurance, but also all the surrounding society support system that exists, especially for those people that are not lucky enough to live in Miami or to go to Soho House. But like there are many, the majority of the US is people that really don't have access to healthcare. So like getting better access, navigating and finding resources through AI.
Yeah, so I'm a graph. I wouldn't say graph scientist because I'm not. I didn't graph, but I've been doing graph computing for almost 16 years. I've been building algorithms since 2008. I love what's going on in the space. Obviously, it's incredible at many levels. You know the way that the industry is evolving, especially in the space of health. I again, it puts a lot of power and responsibility in the hands of people, but I think I think we're learning a lot about these models, right? One of the biggest problems with the models is they are non-deterministic, right? So that could prescribe, and he's very focused on exactly that, like how to create a system that could have all the controls in place, the guardrails in place to obviously be able to pass a very strict FDA process. That's as far as I know about the FDA. But a lot of things are happening. I think that at the end of the day, that's going to benefit society, and as you said, it's going to benefit society, especially for the people that do not have access to these technologies, and sometimes it's not even that they don't have access; they don't even know that it's available to them. Like even right now,
more access to information isn't necessarily a good thing if it's not the right or the accurate or the appropriate information. And so we're sort of at the edge of a cliff here, I think, in which we are going to be inundated with healthcare data that people want to act on because tests are not 100% accurate. They're not. And so what happens if you start testing at a population level something that isn't an evidence-based test? You have a low pretest probability, which means you get more bad results that then need to be chased down. Because if you are an ordinary person and you get a test result that is in the red, that promotes anxiety and you want to investigate that. And you may be a person for whom this test wasn't particularly indicated for in the first place. And so that magnified at the population level leads to a lot of extra healthcare spend that started out of pocket at a patient's own discretion, but very quickly balloons to being charged for the insurer for follow-up diagnostic lab tests. And oh no, now we have punctured the lung and it deflated and now we're in the emergency room. And it may sound like hyperbole, but at the population level, when you go from 10 tests to 100,000 tests to 1 million tests, you see that there is also morbidity and mortality created from population level over-testing. So the use case that I would offer is that in an area where two things we need to hold simultaneously true. One is that there is a primary care shortage in this country, and many people wait for specialists as well. So we need to do something to promote access. And then I think the other is that we spend a lot of money in this country on healthcare, and we don't get better outcomes necessarily for the degree of money that we spend, right? So I think if we hold those two things to be evident, then I would offer that AI really holds the potential to upskill different types of providers to be more confident in their provision of high quality care. And I think that that's exciting both domestically and internationally.
Right, and I mean, to your point, more is not always better, right? So like even, I don't know, kind of a silly example from a consumer perspective, you hear there are supplements now of every shape and size being advertised to everyone about everything all the time. But, because the industry is so little regulated, you are buying a supplement, you don't know if that supplement is in, like what quantity is really in that supplement, right? And so it's not bad that people are now wanting to take A, B, C, D, E in relation to their health, but are they actually able to access quality supplements that have been tested and third-party approved, etc. So same, different application, but same thing. So around this kind of not more, but quality piece, kind of how do we bridge that?
I think this is in my space, so I work with GLP-1s, and GLP-1s, there's such a wide range of quality. There are people that are just getting their GLP-1s directly from China, and some YouTuber says, yeah, this is good and tested, and they buy it and they inject it. Some other people don't do that. And I would say, to me, we lost a little bit the bar in terms of like assuming that everything can be crowdsourced. But I think that the reality is that with medicine, there still are some things that you need to hold true. And quality, for example, quality of medications is one of them, right? If you one thing is to say, I want to go beyond buying tirzepatide directly from Lilly. I want to buy it from a pharmacy. That is fine. But finding the right pharmacy is not a trivial thing. Like working with a pharmacy that you trust is important. Because otherwise you're literally injecting yourself with things you don't even know. Nobody tested them. So my point is, there is the same as for the amount of information. I think we want to try and balance things while maintain the fact that some people, the doctors, can and should be involved with things that are there when you're taking care of your health. So for me, it's a matter of trust. Patients should work with institutions, people, brands, solutions that they trust, and they should have a reason to trust them. That is not necessarily just I see them on some social media, because today that's actually how information is gathered.